This is a very, very cool edition of Ask a Health Pro. Dr. Ian Sunderland, a plastic surgeon. Thank you very much for joining us today. I've got some of these statistics here. The top 5 cosmetic procedures: breast augmentation, nose reshaping, liposuction, eyelid surgery, and facelifts. And you'll look at the number of these procedures that have taken place, all of them on an uptrend. Is that what you're seeing too, an increase in the amount of procedures that are taking place?
Absolutely. I think over the last number of years, the numbers have kept going up and up. I think there's a lot of people interested in doing cosmetic procedures, and certainly we're seeing a lot of people at the office discussing really all of these things.
And when it comes to the ratio of the number of cosmetic procedures you do compared to the number of reconstructive procedures you do, how would you make them scale out?
Well, you know, Kevin, I don't have an exact number. My practice here in Saskatoon is a mixed practice, so I certainly do a lot of cosmetic surgery, but I also do a large amount of reconstructive surgery as well. I specifically focus on facial surgery, and that's my main interest and passion, and so really kind of span the spectrum of cosmetic and reconstructive, and really everything you do on the face does have an aesthetic element.
And what are some of the most common procedures that you, dealing mostly with the face, see?
So often from the aesthetic part of my practice, I have a lot of people coming to see me to discuss some of the procedures you mentioned: rhinoplasty, facelift, blepharoplasty, or eyelid surgery. And from the reconstructive side, I do a lot of traumatic surgery, so people who are involved in car accidents or other things like that, to reconstruct their face and kind of restore their appearance.
And Botox. That's a popular one. I'm pretty sure I've heard that word before. With a procedure like that where you get the injections, is there maintenance necessary? Does that require some sort of upkeep on a regular basis?
So it absolutely does. Botox is huge. I mean, when we talk about some of the procedures you had mentioned, those across America and Canada are in the hundreds of thousands. When we talk about Botox, we're talking 5 or 6 million. So it's something a lot of people are interested in. There is definitely maintenance involved. It does kind of wear off, so to speak, after a few months. And so it's something that does need to be continued over time to try and maintain that look if that's what the patients like. So definitely something that needs to kind of be kept up, and a lot of patients don't mind that. They come to the office every few months and are happy to get a repeat injection.
Now, I'm positive that this has nothing to do with reconstructive, but when it comes to the cosmetic side of the surgery, what's the age range you're seeing now, and is there a bit of a trend growing in one direction or the other from that age range?
I think in general, speaking about aesthetic surgery, really the age range that I see goes from about age 16 to really, age 65 and plus. You have some young women or young men who come in, for example, in the younger age range, who are unhappy with the appearance of their nose. And 16 is kind of a reasonable age to start a procedure like rhinoplasty. Clearly, some of the other ones you're not going to be doing in someone so young, but really quite a large range. For my practice, really the people I see, it's been relatively constant with respect to age range, and really it just does span the board.
And let's just do some, I guess, consultation role play now. What are some of the risks associated when you go under the knife?
So anytime someone comes to discuss cosmetic surgery with me, I'm always very clear to them. Although it's aesthetic surgery and although it's something the patient is asking me to perform on them, the risks are really the same as any surgery, and they can be serious. So there are risks of bleeding, infection, blood clots, which can lead to serious and even fatal events, and also reactions to the anesthetic. And so really, there are specific risks associated with all those surgeries, but I always tell patients, this is still real surgery, and so, there can be catastrophic problems.
Now, we didn't bring the Sharpie, but go on. Give me the review. Where's the critique?
I think we can all say you're a pretty attractive guy. So here on television, I don't think I'm going to say there's anything I would do for you. But you definitely have a nice aesthetic face.
Thank you, Lisa Dutton. I know you're watching from home. In your face, pun intended. Dr. Ian Sunderland, thank you so much for joining us today. A fantastic and very, very interesting look at plastic surgery.
Pleasure.